Pathogens that cause waterborne and foodborne infections include viruses, bacteria, and parasites. I won't read through the list. You could take a look at it while I continue to speak. The relative importance of pathogens that cause these diseases varies regionally, and mainly waterborne and foodborne infection cause diarrheal diseases, although not exclusively. This table shows estimated diarrheal deaths in the world in 2013 by pathogen. What's most notable is that in the majority of the cases, the pathogen is unknown. Also notable is there's more than 1.25 million deaths are estimated, so it's a major cause of death in the world. And it's mainly a cause of death among children. So it's the fourth leading cause of death among children less than 5 years of age in 2013. Waterborne infections in the United States are quite common. This is the estimated number, a total of almost 20 million per year. So what about climate change and waterborne infections? So increased temperature, extreme precipitation, and frequency of intensity of extreme weather events will lead to increased incidence of waterborne infections. So that's kind of the bottom line. And we're going to spend a fair amount of time now looking at the details. So first, temperature. Temperature affects the distribution and survival of pathogens, and pathogens generally reproduce faster at higher temperatures. This slide shows a systematic review and meta-analysis that was performed of ambient temperature and diarrheal diseases. So let's walk through this slide. So first, in the first column, they divided up the studies that were included in the meta-analysis according to pathogen. So 30 were bacterial. 30 studies focused on bacterial pathogens, 8 on viral, and 10 didn't distinguish what type of pathogen. It was all cause. And in the meta-analysis, they calculated a pooled incidence rate ratio and 95% confidence interval. For bacteria, it was 1.07, and for all cause, it was 1.07, quite similar, with fairly tight confidence intervals. For viruses, it actually ended up being not significant, although I could tell you that there are some good studies of specific viral waterborne diseases or infections that convincingly show a relationship with temperature. So let's interpret these incident rate ratios. What does 1.07 mean? It's per 1 degree centigrade increase in either the mean, minimum, or maximum temperature, depending on the study. So some studies might have used mean, some might have used maximum, et cetera, that were included in the meta-analysis. So how do we interpret that? Per 1 degrees centigrade increase. So it's multiplicative. So if we wanted to know about what would be the increase, what would be the rate ratio for a 2 degrees centigrade increase, it would be 1.07 times 1 squared, or 1.14. If we want to know the pooled incident rate ratio per 3 degrees centigrade increase, it would be 1.07 cubed, or 1.23. If we wanted to look at a 10 degrees centigrade increase, it would be about 1.97, or 2, meaning that a 10 degrees centigrade increase in ambient temperature would result in about a 2-fold increase in diarrheal diseases. Okay, now, so we dealt briefly with temperature. Now let's look at storms, extreme precipitation, and floods in relation to waterborne infections. So number one, I'm not going to show these data, but take my word for it. They've been these events have been epidemiologically linked to waterborne infections. Let's focus on the mechanism. So first, we could have disruption of water treatment and sanitary infrastructure. One of the specific concerns is combined sewer overflow, which I'll get back to. Second, we could have spread of sewage in areas with disrupted, poor, or no sanitary infrastructure. Third, we could have runoff from fields containing animal waste. And so all of these factors could result in contamination of waterways, lakes, rivers, streams, beaches, or drinking water sources, then leading to the waterborne infections. We also could have direct human exposure to contaminated floodwaters. And finally, poor sanitation and unsafe drinking water in shelters and camps for displaced populations could lead to waterborne infections. So here's an example. So you see this man in West Virginia standing in the floodwaters in June 2016. And those floodwaters could very well be contaminated with pathogens from sewage or from animal waste that could be spreading disease. And you could see how people get exposed to that during floods. Okay, I said I'd come back to combined sewer systems and combined sewer overflow. So a lot of you probably know how this works, but let me go through it for those of you who don't. So a lot of urban areas, especially in the United States, have combined sewer systems. And so that means that you have the waste, which includes sewage, from homes and businesses going into the pipes. And the same pipes are used to collect, or storm drains. They're used to collect storm water. So they all mix together, and there's a control device that's here and diverts the water to the sewage treatment plant. And under usual conditions, that works fine. On the other hand, if there's too much stormwater, this control device could be overwhelmed by the volume of stormwater and not be able to divert all of the stormwater, which also, remember, includes sewage, to the water treatment, to the sewage treatment plant. And then we have the combined sewage overflow. So this waste just goes out this other drain, untreated, into wherever it's going, streams, rivers, lakes, etc. So that, when that happens, that means that there's a danger of waterborne infections because of the combined sewer overflow. And I think it's relevant to point out the possibility of an interaction between climate change, meaning, because we know because of climate change, there will be more intense hurricanes, there'll be more extreme precipitation events, there'll be more flooding, and there'll be interaction between that and deteriorating urban sanitary infrastructure if we allow our infrastructure to continue to deteriorate. And that could lead to increased incidence of waterborne infections.